Hi, my name is Diana Zuniga. I am a med student and this is the video for my final English presentation. In this video, I will be talking about a disease called progeria. So the first time I learned about this disease, I was about 8 years old and I was in elementary school when a teacher asked us to do some research about a disease we found rare or interesting, and that's how I came across this information. So progeria, or the Hutchinson-Gilford progeria syndrome, or just HGPS, is a very rare genetic disease which causes children to age very rapidly. Children with this disease may appear to be normal at the moment of birth, but they start to develop symptoms of premature aging by about the age of 2. Unfortunately, this disease has a very short life expectancy and most patients die by the time they are 13 or 14, although some may even live to 20 years old or their early 20s. As I mentioned, this is a very rare disease and it only affects 1 in 20 million people. And as of right now, there are approximately 350 to 400 children living with progeria in the whole world. Also, this is a genetic disease which means it is caused by a mutation of a gene, in this case the lamin A or LMNA gene. And as I mentioned before, patients with this disease start to show signs of symptoms of premature aging within their first 2 years of life. These symptoms include the lack of growth, baldness or loss of hair, also loss of body fat and stiff joints. However, the more severe symptoms appear as the disease advances, and some of the more complicated symptoms include heart disease, which is actually the main cause of death amongst these patients, or some may even experience a stroke, which is also a very important cause of death amongst these patients. Some other symptoms may include arthritis, cataracts, or clots, and hip dislocation, as well as fractures.